Good evening, Dr. Spiteri.
Good evening, Leah, and good evening to all those who are watching our TV station.
Thank you very much. We've heard a lot about the memorandum of understanding that was lost and then found, and it's been in the news for the last 2 weeks. What are your thoughts about it? Have you actually seen this memorandum?
I definitely haven't seen this memorandum of understanding, this MOU. Over the last week, I have seen the Auditor General from the NAO office issuing a report, an audit of matters relating to the concession awarded to Vital's Global Healthcare by the government. This issue has been tackled over the last 5 years, a saga which has been ongoing and which has resulted actually in the statement which the opposition has always declared that this contract, this deal, this affiliation with the government has been not transparent at all, financially unstable, lacking the necessary status for having such a company to take care of 3 hospitals which are managed across Malta and Gozo, because we have to actually face the fact that Vitals were taking care of Gozo General Hospital, St. Luke's and Keren-Grek, which are 3 hospitals that are important in the health sector, in a core service such as the health. And what we have seen is basically a financial, infrastructural failure of this contract. The Auditor General, which actually is an authority that is transparent and basically has the respect of both parties in the House, and has issued this report stating that it was a failure from the beginning. This contract has been awarded with a memorandum of understanding, as you rightly said in the introduction, months before the actual tender was issued. So there was an understanding between the government and this private company. We have seen that instead of the government in this PPP, private-public partnership, issuing respect to the citizens of Malta and Gozo and basically seeing that all that is being done is respecting what this private-public partnership is to be honored for, is basically pushing over to this private contractor in terms of millions of euros, and the return of investment being basically nothing. We have seen the targets that has not been honored, the deadlines which has been passed nowadays. We have seen a company that has no CV in the health sector. Imagine a company which is being represented by, anyway, Oxley Group, which is experiencing or specifying details in real estate, financing and banking, instead of the health sector or services, taking care of our health services in these 3 hospitals. The Auditor General was very right in pinpointing that it was an ambitious project by Vitals. Besides, it basically didn't honor any of the contract details, and besides that, our taxpayers' money wasn't used in the way that we had a return that actually the investment done honored the contract.
There seems to be a lot of back-to-back contracts in the process, from vitals to stewards. I believe the original contract, according to information on the public domain, was first signed by former Minister Chris Cardona. Does this ambiguity, Dr. Spiteri, the ambiguity that we see in the lack of transparency in the way these contracts have been conducted, possibly mean that they could be null and void?
There's a lot of points that actually direct us to this contract being null and void, as you are saying. The first is that there was prior interest from this company before issuing a tendering process, which actually disqualifies the whole system. Besides, there was no consultation whatever, as actually said by the Deputy Prime Minister Chris Byrne when he was occupying the post of Secretary in terms of the Health Ministry, that he was not consulted in any way in terms of this concession. So basically, there seems to be third parties involved, the Ministry of Finance and the ministry involved in the Energy and Health at the time, but behind closed doors. And this also suggests that there was no transparency in such a huge contract that, let me remind our viewers, this is a contract for 30 years, pointing to 2.1 billion over this period, which is quite a lot in terms of investment when you see that there was no return for these private investors who went over and over again dictating that they are going to produce a system that is going to work in terms of services and practices. I think there is no other choice in terms of the present government, in terms of the Prime Minister's decision. There is the summary, the executive summary of the Auditor General that dictates, rightly so, that this should be null, and this contract was not ever transparent from the beginning, and it didn't safeguard the citizens of Malta and Gozo. Even it basically went on to give a better situation for the private investors instead of the government of Malta protecting our citizens, which remained basically in a situation where they don't even know what's happening with this situation.
Sure. Just to conclude, Dr. Spiteri, now that the memorandum of understanding has been located, what is the next step? What should we expect?
So we have seen that this contract is being fired basically by the NAO. The opposition has taken this contract even to the law courts because there is a justifiable amount of information suggesting that this should be stopped immediately. The government of Malta should act quickly and see that he safeguards the interests of the Maltese citizens instead of safeguarding the private interests. After all, this is health. This is an issue which affects everybody, and we need to act accordingly and use taxpayers' money in a feasible, understandable, transparent and sustainable way.
Thank you very much, Dr. Spiteri, and thank you for breaking your weekend to join us today. And so that was Dr. Stephen Spiteri, Shadow Minister of Health, with an update on the Vitals Global contracts with the government. Our next guest has been with us here before. He is a human behavior specialist, and we're going to analyze why people become corrupt, why countries revert to corruption and corruptive purposes. Hello, Christian. Good evening.
Good evening.
How are you?
I'm very well, thank you.
Thank you for joining us. I'd like to analyze with our viewers today, why do people engage in corruption?
Look, I think the most obvious thing is because they can. And I mean that both in terms of the opportunity exists, but also because they are able to persuade themselves that it is a sensible course of action. And so you need to have both of those things in place for people to be able to do that. Now, obviously, there are plenty of opportunities that everybody has to do things that are not appropriate, to break rules, but normally we choose not to do that. And so when corruption occurs, there will be specific sets of circumstances. And I think it's also important to remember that when we talk about corruption, it's not one individual thing. And therefore, the different types of corruption can have different causes and different reasons.
What does corruption, what impact does corruption have on other people who are not corrupt, especially when we're experiencing so much in one country?
So I think one of the reasons that corruption flourishes in many places is because the impact is invisible. So often when humans behave in certain ways, they justify it, they're able to do it because they can't see the impact it's having. If we look at what corruption does to wider society, there are huge impacts, whether that's that money is diverted away from where it's intended to go, whether that is, for example, in the proliferation of medicines that are not what they say on the packet, which is dangerous for people, whether that is through other processes where the outcome that might naturally be expected isn't there. So it's everything from a loss of money going to the broader society through to things that people expect the behavior to react in a certain way, not reacting in a certain way. And so it's very disruptive, and this is one of the challenges of it. It's not just a case of somebody, for example, embezzles some money that they're not entitled to. It goes much broader than that, because that means that that money isn't going where it is supposed to be. So the societal impact is felt by everybody. And one of the challenges here is that's not necessarily obvious to the people that are involved in the corruption.
What behavior dynamics causes people to become corrupt?
So I think the first thing is that we all act in a way that we can justify. So we like to do things that are justifiable, and we will find stories to justify our actions. And so the first thing that you might argue is you can say, well, everybody else is doing it. Or if you can concoct a story that says the government is corrupt, and if the government is corrupt, then I might as well do the same thing. And so this argument that everybody is doing it becomes very, very critical. So there is an issue of behavioral contagion where we copy what we think other people are doing, and we can use that as a justification. The other piece might be simply that nobody will notice. Very small acts can become large acts very quickly. So we start small and get larger. We normalize these sorts of behaviors. And I think the other piece simply is that where it is directly a case of taking money is that money has always been proven to be a temptation for people. And so if you give people opportunities for money and they can convince themselves that it's an appropriate course of action, then they'll do it. So this idea of seeing everybody else is a key component, but also the ability to tell ourselves a story that it's perfectly normal and acceptable.
How does one normalize corruption?
So what is really interesting about human behavior, and you can see this in all sorts of different fields, is that typically we make small changes. We get comfortable with small changes, and then we change further. And you can see this in a positive sense, where people change their lifestyles positively, start doing a little bit of exercise, that becomes more comfortable. But equally, we can see it on the negative side, where small steps lead to larger steps. And so one of the challenges with corruption is that nobody starts out generally committing large acts. They start with small acts. Those small acts don't go unnoticed, or they get away with it. And that emboldens them to go and do bigger and bigger acts. So it builds up slowly over time, and it can build up very, very quickly after that. So this idea, I think, that corruption suddenly appears is not correct. What we see is a steady build-up over time, a slow piece where we try a little bit more. And we know this instinctively ourselves in other behaviours, that behaviour builds up over time. And once a small thing becomes acceptable, we try a little bit more and we go a little bit further.
To conclude, Christian, do you think this process that you're describing applies to governments and leadership also?
Absolutely. I think governments, particularly if you're an elected government, you can persuade yourself that you have been elected to deliver a particular mandate. You have a lot of power and influence. And so it's very easy, I think, once one starts on a route to continue down that path. And you can use the justification of your electoral mandate to justify your behaviours and a stretch into this space. So the same dynamics that we see for individuals also apply for governments. And of course, people within government have greater opportunities to do these sorts of things.
Thank you very much once again, Christian. Thank you for joining us. That was Christian Hunt, who's a human behavior expert. We're having a short commercial break, and I'm going to be back with you very soon.